Mr. Secretary, thank you. Are Title 42 expulsions sending Haitians back to danger in Haiti immoral? Yes or no?
No, they are not. They are driven by a public health imperative.
I understand the public health imperative, but are they immoral?
But let me explain, because let me be quite clear. We do not conduct ourselves in an immoral way. We do not conduct ourselves in an unethical way. In fact, we are restoring people by reason of the immorality of the past administration. We are reuniting families that were separated. Let me explain something, the reality of the situation, because we're dealing with a great number of individuals who are encountered at the border in a congregant setting and placed in customs and border protection, border patrol stations. And that can cause the significant spread of a pandemic. And it is in light of the operational realities that the Centers for Disease Control made a determination in its public health expertise that Title 42 authority must be exercised. It is a statutory authority. And they made the determination that the public health of the migrants themselves, our personnel, local communities, and the American public require it. And that is why we are exercising that authority to serve the public health. Over 600,000 Americans have died. More than 40 U.S. Customs and Border Protection personnel have died. Many migrants have gotten sick. We are doing this out of a public health need. It is not an immigration policy. It is not an immigration policy that we would embrace.
Okay, Rachel, last one. Go ahead.
Secretary, thank you.
So let's have Rachel on her question.
Congregation under the bridge, congregating, they were just mentioning COVID. What is the situation there? I know that the crowd has been dispersed. Do we know who has tested positive, if people got sick, any kind of symptoms among this group of 15,000 you said?
Yes. So we did not test that population of individuals. We do not know. I do not know. I should say, if I may be perfectly accurate, I do not know whether anyone was sick with COVID. We certainly had some individuals get sick, not specifically with COVID to my knowledge, and we addressed their illnesses. In fact, we set up medical tents that had a certain standard of ability to address medical needs. It's hot in Del Rio, Texas. We had cases of dehydration. We had other situations, and that is precisely why we surged approximately 150 medical professionals to address the medical needs of that population. That is why we set up medical facilities with the appropriate equipment to address their medical needs. And I must say, what I saw of the Border Patrol and other personnel was quite frankly heroic. This is not their customary obligations, and yet they took great pride in addressing the needs of the people.